Good afternoon. Thank you for tuning in to this briefing on our community's preparedness for coronavirus.
This is Caleb Henry with 1400 KLIN. We take you live now to Lincoln Mayor Lyrian Gaylor Baird discussing how residents can access the services they may need due to COVID-19.
All right. Lincoln is an amazing place to call home, and in times of crisis, we pull together in extraordinary ways. We know that our residents may face new and for what may seem like insurmountable circumstances at this time. Many in our community are facing critical financial challenges, some for the very first time in their lives. I want to assure residents that there are resources available to assist them in their time of need. Our community offers a host of support systems, and I'm here today to highlight that existing network of support and to connect those who are in need with our community's valuable resources. First, the city's website now has a new page with a resident resources tab that links to sources of assistance in our community. You can find this page by going to the city's main website page at lincoln.ne.gov and clicking on the red COVID-19 banner at the top of the page. Second, there are several existing valuable resources that I want to highlight. My LNK is a free app with a directory of services and resources from nearly 500 organizations and 1,000 programs in Lincoln and Lancaster County. In fact, all the services that I'll be discussing today can be accessed via this app. My LNK can be downloaded for Apple and Android phones and works offline once downloaded. I want to thank Leadership Lincoln, Don't Panic Labs, and the Center for People in Need for developing this resource, as well as to all of the nonprofits who have contributed to the directory. When it was first built, we never anticipated how valuable it would be in this moment in time. Additionally, the United Way has developed a resource called 211 that provides information on services available in Nebraska and Iowa. To access this information, you can call 211 or text your zip code to 898-211 and get connected with a helpline specialist. Residents in Lancaster County may also apply for general assistance through the Lancaster County Human Services Department. Eligible clients can receive support for medical care, vouchers for vouchers for non-food necessities, such as household and personal care supplies, and security deposit, rent, and utilities assistance. There are a host of resources available in our community to assist with our residents' basic needs, including food, unemployment assistance, and housing, and I want to highlight some of those now. We know that access to food and other basic needs is a growing concern for many of our community members at this time. We have several support options in Lincoln, including both FoodNet, which provides food distribution at sites across the city every day, and the Food Bank of Lincoln. All FoodNet sites and distribution times are listed in the My LNK app, as are food bank programs and many other food resources in our community. For those who have lost their jobs due to this public health emergency, unemployment insurance benefits may be available to you. The governor has announced that the state of Nebraska is waiving some requirements for obtaining unemployment benefits to assist Nebraskans who were laid off or told to go home because of the coronavirus. Starting on Sunday, March 22nd through May 2nd, the state is waiving the 1-week wait time to start collecting benefits, as well as the requirement that people receiving benefits look for work. The state is also waiving charges to employers for providing benefits to their former employees. You can find more information about how to apply for unemployment insurance benefits at the Nebraska Department of Labor's website. That's dol.nebraska.gov. In addition to food and unemployment benefits, and I'm sorry, I'm just asking the media to try and mute your phones while I speak so that we can get this information out, and then we will be coming to you for questions shortly. In addition to food and unemployment benefits, we know that housing will be top of mind for those in the community who've been laid off or are seeing a reduction in their work hours. The Community Action Partnership and its homelessness prevention services offer emergency rent assistance, landlord and tenant mediation, and information regarding tenants' rights. You can find more information at communityactionnetwork.org. At this time, I'd like to invite up our Interim Health Director, Pat Lopez, to share some of the work that she's been doing with our community service providers to protect residents, just to give you a little sense of behind the scenes the work that the Lincoln-Lancaster County Health Department is doing to connect with our social service providers. Pat, if you just have a few words to say.
Good afternoon. We have been meeting with some of our healthcare providers and other service providers to find out where we have existing needs and resources to address those. And one of the larger things we're doing is working with the Community Health Endowment to work with our nonprofit agencies and identify those most at risk and most vulnerable for either homelessness or other medical needs. So that's a process that's going on that involves many community contacts, and we're very fortunate to have the assistance we have in looking at that, and that will include our work with the food bank to go forward in meeting those needs.
Thank you, Director Lopez, and I want to say thank you to Lori Seibel at the Community Health Endowment as well for her vital work on this cause. We are grateful to many service agencies in our community that have always provided support to our most vulnerable residents and who are stepping up now that we have new needs and that there are newly vulnerable residents during this crisis. I want to assure the public that our local, state, and federal government are working to find policy solutions to support residents in their time of need. The existing infrastructure and supports provided by our nonprofit network are going to be more essential than ever as we work through how to distribute new resources in the coming weeks. Thank you to all of you for helping us to get out the word about how to connect Lincoln residents with urgently needed services and assistance. And at this time, I would be happy to open it up for questions.
Hi, this is Bailey with 1011. I was wondering, you declared the city emergency. What are some specific, are there any resources that allows the city to use that they wouldn't have had without that?
Thanks for the question, Bailey. The local declaration of emergency is helpful in a number of ways. We know that to receive federal and state reimbursements for crisis-related expenses, that we need to be documenting those, and this local declaration of emergency puts us in a place where we can be eligible for reimbursements. So it's critical for other supports from different levels of government. It also helps us in terms of speeding up our actions to address the crisis. For example, our normal purchasing processes involve lengthy RFPs, and those are important policies that we honor during the course of normal times. But in a state of emergency, we want our purchasing director to go after personal protective equipment and not have to follow our traditional processes, which can be lengthy and time-consuming. So that's another example of the benefits. And so it also allows us to potentially draw down on other existing resources and savings that we would normally not turn to in normal times. I'd be happy to take another question.
This is Bailey again. How many people is Lancaster County currently monitoring for symptoms, and have any more people been tested?
I'm going to bring Health Director Pat Lopez up here. She has the situation report from this morning. Again, there are still no confirmed cases in Lincoln and Lancaster County, but we are monitoring. So let her take the microphone.
As the mayor said, there are currently no cases in Lancaster County. We're monitoring 26 people due to travel history, and we will be entering another 91 people into the monitoring system today. We've had 41 negative tests, and we have 2 pending tests. And the private labs began testing in Lincoln, and those results are being sent electronically to the health department.
Thank you.
Why such a big increase between yesterday and today?
I think that you probably saw the information that came out about the 4 areas in Colorado, the counties there. So that's increased our monitoring here as people have returned from spring break.
And for those of you who may not be aware, that the Colorado Department of Health is working collaboratively with us and let us know that we want to monitor people who are at certain resorts over the spring break. And so we are in those communities. And so that is part of what the health department is actively monitoring. Other questions?
Bailey again. So I know that there are no one's tested positive for the virus in Lincoln, but with how limited testing is it possible that the virus is here in Lincoln? We're just not getting those people tested, or they're not seeking medical attention at this point?
That, Bailey, this is Pat Lopez again, and of course that's possible, and that's possible in any area of our state, actually. But that is something that we're always looking at in our monitoring, of course, to see, but that's true across our state.
Riley from the Journal Star here.
Hi, Riley.
Curious if there's been any considered any more consideration given to enforcing the guidelines.
Riley.
Curious if there's been any considered any more consideration given to enforcing the guidelines.
Riley.
Curious if there's been any considered any more consideration given to enforcing the guidelines.
Riley.
Curious if there's been any considered
I'm sorry, Riley, you're on repeat for some reason. Riley, would you please text your question to Diane Gonzalez so we can get it answered? We can't quite make out what you're saying, and it's on a loop.
We can't quite make out what you're saying, and it's on a
It's a
loop.
recording.
Can you have ask them to turn down
Get it
the
answered. We
volume
can't quite
of
make
the
out what you're
speaker
saying,
if
it's
they're
on a
monitoring
loop.
the feed?
Oh.
What's happening if there's a delay in the feed and
Okay.
it's starting to loop?
Okay.
Somebody has it turned up.
Our technical experts are saying that if you could turn down the volume on the feed, that would help, because we're starting to hear recordings when you ask questions. So that could be one way to help with this technical issue. Has Riley's question come through via text? Okay, Riley, we want to answer your question. If you could text it to Diane Gonzalez at, well, you know her number.
It's in the advisory.
It's in the advisory. So, does someone else have a question, or?
Okay, got it.
Okay, we have your question via text, Riley.
Any more consideration given to having health department or LPD enforcing 10 PPL limits? I think that's 10 person per location limit. Any more consideration given to having health department or LPD enforce that?
I think at this point, what we are seeing is that our community members are responding to these guidelines and recommendations. People in Lincoln want to do the right thing. We are not looking to cite people for gathering, but we want them to get the message that these aggressive and bold measures that are being recommended and undertaken by so many of us are meant to protect the health and safety of our most vulnerable residents. We all have a part to play. We're asking everyone to observe the guidelines so that we can both protect our residents and prevent our healthcare system from being overburdened. This is a rapidly evolving situation. It may be that at some point in the future that is an action we will need to take, but right now that is not one we are taking. Any other questions?
Hi, it's Bailey with 1011 again. I know we've seen a lot of buzz online saying that cities in the United States are not that far from situations that are happening in Italy right now, like where they're completely shut down. What's kind of the worst case scenario that you guys are planning for right now, and how should people prepare? Is there anything that additional people need to do to get ready in case there was something, in case this advances further than it has?
Well, let me just say that we're all going to get through this together, and it's going to take months, but there will be an end and there will be a recovery. And so what we're focused on right now locally, because we are fortunate enough not to have a confirmed case, is that we are focusing on getting out the messages about all the ways people can prepare, how they can protect themselves and their families, how they can practice social distancing and good hand washing hygiene, among others. All that information that we've been pushing out that's available on our health department website, because these are the heroic acts that people can perform. What we're trying to get people to think about is how they can help, not how they can hoard. Again, people don't need to buy bottled water. City water should be absolutely safe for drinking and consumption and is not at risk. We do recommend that people, in the event that they need to quarantine, have on hand 2 weeks' supply of food and essential medicines so that they can, be at home and have what they need. We, of course, are planning for worst-case scenarios, but my job is to reassure the public that that planning is taking place. And again, we in Lincoln are not that as far as other communities are down this pathway. We're learning from their experience, and we're fortunate to be able to take actions that are informed by their experiences. It's going to be hard. This is going to be challenging. We are so aware of how much struggle there is even now, because despite having no cases, the economic impacts are beginning to be felt in real ways for residents. That's why we wanted to do this briefing today, to try to connect our most vulnerable residents and our newly vulnerable residents with supports and resources that exist in Lincoln and Lancaster County.
And this question is from Mark Vale at KLIN. Have emergency requests for additional supplies been made by the health department?
Hello, it's Pat Lopez again. Yes, we have made requests. We're actively seeking sources for other supplies, and we have an electronic system that we've sent out to all in our community, both in the city and county, and our health system, to see what their needs are. And so we have a planning team on that that's been working on that for some time.
And I would add that we're grateful to our state senators who are trying to find a way to potentially provide emergency assistance. We have presented them with our requested wish list of resources and for items such as personal protective gear, and to allow us to continue our critical city services. And so we're actively collaborating with them to make sure they understand the needs of Lincoln.
It's Bailey with 1011 again. Just anecdotally, have you heard any stories of economic impact from people, things that just kind of prompted this press conference?
We're hearing from people. People are reaching out. We know that people are faced with a lot of uncertainty. We know that the hours of many restaurants are changing. We know that these limitations in the size of gatherings are having their immediate impact on employees. We're concerned about workers. We're concerned about small businesses. I participated in a virtual town hall convened by Congressman Fortenberry, where we heard from local business leaders and small business owners. One woman recently purchased an event space, and that was just launching her business. So yes, we know that this is really impacting people who live right here in Lincoln, and we are actively working around the clock to try and address their needs and concerns. We'll be continuing to work with the Chamber of Commerce and the Lincoln Independent Business Association. We're planning to do another town hall type forum virtually to make sure that we are understanding the most top priority needs so we can be responsive to them as we hear from our neighbors and residents and businesses.
Hello, is it open for questions?
Yes.
Hi, this is William Padmore with KLIN. Can we get a number of how many test kits are available in Lancaster County?
I don't have that number available at this time. What I think you're getting at, of course, is the idea of, are there enough? And, we are actively trying to ensure that we get more testing kits. We are able to test and monitor through the state public health lab that's housed at UNMC. That is where these tests are being undertaken for the most part, but we're seeing that our commercial sector, private partners are stepping up production, are now testing in some cases and able to provide those test results to the Lincoln Lancaster County Health Department. Do you want to speak to that, Pat?
Currently, we still don't have enough test kits available, and I know that the commercial labs are working very hard to make more tests available. One thing that has helped is that our healthcare provider community is really working hard to focus on those at greatest risk and at most need of using the tests that we have available. And I think it's really important that we remember that because our supply is still limited in that area. But those commercial labs are working very hard to get more tests into the community and available for us.
This is Bailey with 1011 again. Is the lack of testing available, is it hindering the ability to stop the spread of this at all?
You know, we're monitoring a lot of other things besides just the COVID test results. We see what's going on with influenza and other things at the health department. So there's a lot of other measures that we use to detect changes going on in the community. So we can tell if we're having an increase of respiratory illnesses and other kinds of illness that would lead us to take different measures. So even though we don't have the test kits, we have, and maybe we don't have the test results, there's other active monitoring that we do to inform decision making.
What kind of monitoring?
All testing that's done related to a variety of illnesses is reported into the health department data system, so we're able to keep in contact with providers and seeing and knowing what they're seeing in the community and looking at test results from tests that are sent in for other issues into private labs and into the public health lab.
Other questions? Any other questions from the media?
I have a question.
Sure. If you could just
Is there
identify yourself.
anything being done
I'm sorry, could you just please
in the
identify
way
yourself?
of- Hello?
Could you just please identify yourself?
Yes, my name is Echo Bell. I am a local business owner.
Oh, I'm sorry, this is a media briefing, and I'd be happy to have our office respond to your concern outside this media briefing.
Sure. We wouldn't want the people in. Thank you so much.
I think that's an example of the fear and concern and anxiety people are feeling, and I want to assure Ms. Bell and all others that we are aware. We are incredibly focused on addressing your most immediate and pressing needs, both from a public health standpoint, as well as all those employers and employees who are facing very different circumstances than they were even a week ago. We are actively seeking your input. Please don't hesitate to email us at mayor@lincoln.ne.gov. Again, this briefing is a media briefing. We're trying to push out a message of how employees and other residents who are newly vulnerable as a result of this pandemic can connect to our strong and existing network of resources. Again, please go to lincoln.ne.gov, click on the red COVID-19 tab. You will find resident resources there, along with the latest statistics and other information about what the city is doing to address this crisis. Thank you. I think she hung up. Is there another question?
Oh yeah, do you have time for another question?
Yeah, I'm sorry, could you identify yourself?
Sorry. This is William with KLIN again.
I recognize your voice
we've been
then after
hearing
you started
reports-
talking.
We've been hearing reports about people taking toilet paper from I-80 rest stops and reports like that. Anecdotally, Hy-Vee, I've been hearing reports from people about how toilet paper is flying off the shelves and they can't keep it stocked. Are there resources in place to answer community needs for such things if people can't find it commercially? Things like toilet paper.
I guess off the cuff, William, I would say that part of the governor's declaration of a state of emergency for the state of Nebraska was in part to remove some of the restrictions on the trucking, delivery of transportation of commerce and things that people need, so that we can continue to ensure that our stores are stocked. We know that people are concerned that they have everything they need. We're going to continue to try to reassure the public that this is going to be an issue for many months. We're going to continue to work to ensure that our supply chains are moving. There are, alternatives to toilet paper that people can use if they need to. But that's a question I think I'd have to research a little more and get back to you on, other than, recommending that people find alternative products that they feel comfortable using. Any other questions? Okay. Thank you. Oh, go ahead.
Yeah, it was William again. I had just one more follow-up, and it sort of ties into the first one, I believe. Sort of the same question, but for food banks and our local food banks, are they sort of ready for a potential surge in demand that they might see from people who have at least temporarily lost their jobs?
I imagine that, like the city and like so many businesses, that they have been working on their continuity of operations plans. I don't want to speak for the food bank or FoodNet, but they know how much people rely on their services, and they're also keenly aware that we are going to have newly emerging vulnerable residents. So I can look into that and get back to you, William. But I think one of the great things about all of our social service providers in Lincoln is that they are doing everything they can to step up to meet the needs of our community. I think under normal circumstances, I would have invited them to be here physically present to participate, but in an attempt to observe the social distancing measures, it's just me and Director Lopez today. Any other questions? All right, thank you for participating virtually in this briefing on coronavirus preparedness. Thank you for helping us connect our residents to valuable services again on our website, lincoln.ne.gov. Click on the COVID-19 banner. It'll take you to a new information page. And I want to highlight once again the My LNK app, which can be downloaded and used offline by any resident who has access to a smartphone to then access vital services. Thank you so much.